Namaskar, greetings of the day. I am Dr. Somnath, Senior Consultant Physician and Diabetologist, TX Hospital, Uppal. Now there is one very common thing I am going to speak or I am going to tell you regarding blood pressure. Now what is blood pressure? It is a simple language, it is the pressure of the blood that is running through your body. That is called blood pressure. There are scientific definition. But commonly you think with the pressure the blood is running throughout your body from toe to your brain. That is blood pressure. Now, what is the normal blood pressure in adults? On an average or as per JCI recommendation, there is a blood pressure society, as per their recommendation, normal blood pressure is 120/80 millimeter of Hg. That is a normal blood pressure. Now, when to start or when I develop blood pressure or when should I start medicine? First, you understand what is the high blood pressure. As per the recommendation, if your blood pressure is 140/90 millimeter of Hg. This is the number. You must control your blood pressure. Many people ask me, or in OPD, sir, my age is 60 years, I am having 150/90, is it normal? But as per our recommendation, there is no age factor in the normal blood pressure in the adult. Means above 18 years of age, if your blood pressure is more than 140/90 millimeter of Hg, you must control your blood pressure, whether you take with the lifestyle changes or with the medicine. So there is no, even 18 years people having 140/90 millimeter of Hg of blood pressure, he must consider reducing it. Even 65 years of age must consider reducing your blood pressure or controlling your blood pressure. This is high blood pressure. Now, another aspect of the blood pressure. Many people comes here, I am having low blood pressure. Now, what is low blood pressure? You tell, sir, my blood pressure is always 160 and this is, I am feeling low blood pressure, I am taking this. No. There is no set definition for low blood pressure. Practically or clinically, when blood pressure is below 90/50 millimeter of Hg, we advise them to be careful because it might give you the giddiness, sense of unsteadiness. So that you have to be very careful. If it is below 90/50 millimeter of Hg, that is called low blood pressure. Second point you can understand, even if your blood pressure is continuously 90/50 and you don't develop any symptoms like decrease in your urine output, giddiness, sense of falling, while getting up from the bed, you feel giddiness. These are the symptoms of low blood pressure. If you develop all these things, you must consult your physician at the earliest. If you don't develop these symptoms, no need of consulting. Take good food, do the lifestyle modification. Because if blood pressure is low, and really it is affecting you, means if it is below 90/50 and it is really affecting you, first of all, it will compromise your brain and your kidney. That details I will tell you in the afterwards, but these things you must understand. Now, again coming back to the high blood pressure. It is called, high blood pressure is called earthquake. Why earthquake? It is a very important question. Because high blood pressure gives any complication in the body suddenly. It will not wait like diabetes. Gradually it will give you the complication like burning foot, or complication to the eye. No. Blood pressure gives sudden complication. That's why it is called earthquake. Means if blood pressure is not controlled and suddenly it becomes high, it might give you the stroke. Whether it is brain stroke or your heart stroke, or it might affect kidney suddenly also, or it might bleed inside your eye also. Suddenly, it will not give any symptom. As per the study, in India, more than 50% of patients are undiagnosed for hypertension because they always tell their doctor, I don't have symptom, why should I have the blood pressure? Don't take it lightly because blood pressure always, most of the time gives sudden symptoms. Severe headache, severe throbbing headache. In the night you are sleeping and morning you are getting a severe sudden headache and you develop a stroke. This is happening because of lifestyle problem, stress. These days everybody is behind that. Always get checked your blood pressure. Whenever you go to the physician, or if your age is more than 40 years, routinely you check your blood pressure with your doctor and discuss with that, because blood pressure in 70% of cases, blood pressure will not give you the typical symptom like headache, throbbing headache, it will not give, like eye pain, it will not give, like body pain, it will not give, not typical symptom, it will not give blood pressure in 70% of cases. That's why be careful with your blood pressure. Now, how to control? Even if your blood pressure is borderline, many people are telling me, sir, this is borderline, what should I do? Okay. All disease is not treated immediately by medicine. If your blood pressure is borderline, your doctor is telling, you must ask him, what are the non-pharmacological treatment? Means, what treatment should I start without medicine, without tablet, so that I can see and observe? Then what will doctor, he will assess your body function, he will assess your different organs like kidney, liver, heart, brain. He will assess if there is no defect or there is no effect of the blood pressure and all these organs. He will suggest you the lifestyle modification. Lifestyle modification is exercise, low salt diet, and yoga to keep yourself stress free. These three are the lifestyle modification. You are doing these things, even if it is not coming towards normal, your blood pressure, you must consider taking medicine for that diet. Because by taking medicine, you are not doing any harm, even if you are controlling your blood pressure and you are preventing the complication of blood pressure. By not taking medicine, you are doing harm to yourself. You are prone to develop complication of the blood pressure. You must, because very simple example, you understand these things. If your blood pressure is borderline 140/90 millimeter of Hg, this is the number I am telling you, suppose. If you develop sudden stress, your blood pressure shoots 20 points above 160/100. What will happen? It might give you the complication. Same scenario you consider. If your blood pressure is 120/80, you develop sudden stress, sometimes of anxiety, and your blood pressure shoots 20 points. What will be there? 140/90. It means still you are on the protective zone. This is the difference you must understand, because in these days everybody is having a stress, everybody is having work pressure, everybody is having a study pressure, everybody is having a performance pressure. All these things together, you must keep your blood pressure under control. Many people are telling, sir, I don't get anger, even then my blood pressure is high. No, that is not the typical symptom. Because anger, anxiety is the personality things. Some people, some personality don't get anger even if you insult him. These, you cannot relate those things if your blood pressure. That you must understand. Thank you.